Hello and welcome to an introduction to anthroposophic medicine. I'm Dr. Adam Blanning. I'm the training director for the physician education programs in anthroposophic medicine for both the US and Canada. This is part 4 of an introductory series where we have looked first at fourfold clinical insights, and now this will be a second examination of a dynamic view of physiology. And we will look specifically at how a threefold understanding of a nerve sense system, a metabolic limb system, and a rhythmic system can help us create individualized diagnosis and treatment plans for patients, especially when we're working with chronic illness. So this is part 4, and we continue to look at the threefold human being and how dynamic understanding of physiology helps us create pathways to individualized therapeutic support. Now in part 3, we saw several different ways of looking at this dynamic physiology. And on the left, we have a drawing which Rudolf Steiner gave to the first teachers of the Waldorf schools. And we have a round structure of the head. We have a kind of crescent moon structure of the chest, and then we have radial structures of the limbs. And he related these to archetypes of thinking, of willing, and of feeling. Thinking related more to round structures, willing to radial structures, and feeling to a kind of transition or mediation between these two. Now, if we look at the figure on the right, we can say thinking definitely belongs to the head. And in the head, we have a collection of sensory organs. This is really where we are primarily taking in the world. This is our receptive physiology. And in contrast to that is our active, outwardly engaging physiology. And this is really happening with our limbs. With our limbs, we meet the world, we transform the world. This is where we're actively engaging with substance. When we're thinking, we don't engage with substance in the same way. A tree or a person or a piece of music, it doesn't necessarily change in its essential content if we engage with it through our senses. But when we use our limbs, we're actually meeting the world and transforming substance. And in a parallel way, we can also think about the metabolism and the digestion as being an inner world where we are similarly engaging with and transforming substance. So we have a receptive physiology of the head and the senses, and an active, transformative physiology of the limbs and of the metabolism and digestion. And then in the middle, we have a kind of mediation, a meeting between these two. This is related to our feeling realm here in the middle. And so in anthroposophic medicine, there's recognition of a nerve sense system, of a metabolic limb system, and what is commonly termed as the rhythmic system in the middle, this system of mediation. Now here we have an illustration from the textbook Functional Morphology by Johannes Rowan. And although they are most strongly expressed in different parts of the body, these processes overlap a great deal because, of course, we have neural tissue running all through our body. We have circulatory blood vessels. We have exchange through capillaries, arterial and venous flow all through the body. And then we have digestion, which, although it's mainly concentrated in the abdomen, of course, we have metabolic processes happening all through the body. These three work together, although they have different archetypes. And one of the archetypes we can look at is that for our head and for our senses, this receptive activity is generally working in a centripetal direction. We are taking in things from the periphery and bringing them into a center point. In contrast, with our limbs and our metabolism, we are generally reaching out to the world. We are engaging with the world. There's a kind of movement from the point out to the periphery. And then in the middle, we have an alternation. It's really not a still point in the middle where these two are perfectly balanced, because we could say, well, if we have centripetal forces and centrifugal forces working together, we would reach a kind of stasis. But actually, this middle is the most dynamic, where you have a rhythmic alternation between these two kinds of forces. Now, if we begin from a starting point of saying the head and the senses really have this centripetal movement, and the limbs and the metabolism really have this centrifugal movement, then we can begin to look at this in terms of actual physiology. And if we were thinking about centripetal forces moving from the periphery into a point, these are always going to be bringing a certain kind of forming and even a hardening activity. So any place in the body that we are creating specific structure, there's a forming and hardening activity. And in terms of our circulatory system, this plays out all of the time whenever we have vasoconstriction. If we look now at these centrifugal forces, this is obviously not vasoconstriction, but vasodilatation, where we have a relaxation, an opening of the blood vessels, increasing and supporting the flow of blood. And if we look at that as an archetypal process, it's generally going to be related to loosening and releasing, as opposed to the forming and hardening of the head forces. And in the middle, where we have a mediation, we can indeed see that there is an alternation between these two, because every time the heart beats, there is a kind of almost lightning movement of vasoconstriction with systole, and then an equally brief but flexible movement of vasodilatation whenever we have diastole. So looking at our circulatory system, we can see that in our healthy everyday physiology, we have all three of these different kinds of forces at work. Now, if we take these same dynamics, but we think not about healthy physiology, but imbalanced physiology, specifically hypertension, then we can again see three different patterns. And this is very helpful, both in terms of diagnosis and an individualized treatment. And what we will go through in the next few slides, these are thoughts that were put together by Thomas Breitkreutz and Annette Bopp in their book, Lowering High Blood Pressure. And these observations, these are not unique to this book. This is really something that is true in all of anthroposophic medical practice, but it's brought in a particularly accessible way through their descriptions. So if we begin with a kind of excessive constriction and say, well, there are certainly types of blood pressure where people are more pale and where there seems to be an imbalance in their nerve sense system, where they tend to be very, very anxious, and their blood pressure will go up tremendously with different kinds of stress or anticipation or worry, then we can recognize that there is a stress type of hypertension. In contrast, when we come down to this metabolic limb system, instead of constriction, we can think about there still being elevated pressure, but it's due to an overfilling. And overfilling is part of an imbalanced metabolic limb system process. There's too much filling, there is too much loosening, there is too much metabolic activity. And this would be someone who we could term a metabolic type, or within this book, it's also called an abdominal type. And then in the middle, we find hypertension, which is most strongly influenced by a loss of rhythm, an imbalance in the rhythmic system. And this is described very nicely as a chaos type of hypertension. Now, if we look at stress type hypertension, this tends to happen in people who have an accentuation of their nerve sense system activity all of the time. And even if you don't have hypertension, generally, most people find that they fall into one of these three categories, just in terms of how their physiology tends to respond to things or to get out of balance. For those who have the stress type, these are people who accept responsibility to the point of fatigue. They can be perfectionists. They very often experience anxiety, worry, and can have agitated feelings, an agitated mind, where it's very hard to let go of things. And as part of this kind of centripetal force, this vasoconstriction, there's a bottling up of anger. There can be a lot of resentment. Also a lot of attempts to rationalize why things are a certain way. And when our nerve sense system is too activated, our digestion tends to be suppressed. And these are people who will lose weight when they're stressed. They may not have much appetite. Now, in terms of a therapeutic approach, these are very simple, but actually very effective lifestyle modifications. We're really trying to take a break, reducing the pressure, opening the window for some fresh breath. That can be very helpful. Encouraging people with this stress type hypertension to do exercise that is more recreational than athletic or performance oriented, because it is possible to be doing exercise which is also very stressful. You can run, and if you're continuously worrying about your time, you're still in this over accentuation of the nerve sense system. And then finally, enjoy your evenings. Don't work until the point of exhaustion and then just fall into bed. Now, if we go to the other side, to the metabolic or abdominal type hypertension, these are people who sometimes have trouble coming into form, sometimes have trouble getting going. They can feel lethargic. They may not particularly like exercise. So we can see at the bottom, if they don't like exercise, it's very helpful for them to be doing social sports or an endurance sport where once you get going, you can go for a long time. But they don't have to constantly be restarting their activity. People with the metabolic type hypertension tend to be sociable, cheerful. They're always warm-hearted and always feeling warm. Their metabolic system tends to be overactive, so they may overeat when stressed. They can become overweight, and metabolic syndrome is much more common. So a helpful lifestyle approach for these patients can include a high-protein diet, being thoughtful about the glycemic index of foods, seasoning with other spices besides salt, and again, these recreational activities of saunas, endurance sports, social sports, or dancing. Now, if we come to the chaos type of hypertension, this is where life is erratic. It's easy to lose your rhythm. Things feel like they are constantly just trying to be met. Many people in this category are very creative, can be quite amazing multitaskers, but the challenge is that their body doesn't quite know what it should be doing. Things tend to be unstructured and erratic. They can have greatly fluctuating blood pressure, sometimes even irregular heart rhythms, arrhythmias. And so a therapeutic approach is really trying to create sound rhythms for sleep and for digestion, recommending things like eating little or no food after 8 p.m. That's a good way to ground both eating and sleeping rhythms. And probably most important in this day is to avoid being a slave to electronic media. If you tend to be erratic in your own physiology, then electronic media is not going to tell you when you've had enough. It will always be there, and it will always be asking for something more. Now, that was a picture of hypertension. If we take these same dynamics and we move to a different kind of illness, we have, instead of high blood pressure, migraine, and we can use the same kind of threefold approach. And with a migraine, we're going to still use these general categories. We could say there's a sensory type of migraine, and this has mostly to do with sensory impressions or sensory strain being the triggers. So we could say there are nerve sense triggers. And there are some people whose migraine is very much conditioned by too much studying, too much screen time, too much sunlight. They know none of those things are good for them. In contrast, we can still say that there's a metabolic type of migraine. And here we see more of a predominant pattern of food triggers. Problem foods, menstrual migraines can also fit very much into this metabolic type, where differences in our own metabolism will spark a change. So metabolic triggers. And then a third, we can also call this a chaos type of headache. This is particularly influenced by irregular sleep, jet lag, and erratic eating. And we can say rhythmic or irrhythmic experiences are the triggers. Now, very similarly, we can think about the same kinds of recommendations for simple everyday lifestyle changes. For the sensory overload as a trigger, we want to be very careful about too much intense reading, studying, and screen time. And sometimes you can get a clue into this pattern because people find that what they really need to recover from their headache is a dark room and a quiet environment. They actually need to reduce the activity in their nerve sense system. They need to stop taking in sensory impressions and usually sleep. Sleep is a very good way, of course, for us to nourish and rebalance our nerve sense system. But besides having to go in a dark room and a quiet environment and sleep, we can just encourage people to stop routinely pushing past the point of fatigue, to create more rest, again, to enjoy the evening. For those who have more dietary or metabolic triggers, where there are problem foods, classic things like aged cheeses, red wines, MSG, where people know that if they eat something, it's going to give them a migraine, and they may have a pattern where they're much better after vomiting, or sometimes people even get diarrhea. This is the need for a kind of dietary cleansing, a clearing out of the digestive and metabolic system so that things can get back into balance. And for these people, you want to certainly avoid the problem foods. And this is particularly important when someone is overloaded. Sometimes if we are too busy, too stressed, traveling, then we tend to indulge in things that maybe we know are not so good for us already. And that can trigger a migraine. And then generally, therapeutically, you want to strengthen digestion, stimulate better detox and release through the metabolic system. And then for disrupted rhythm, where this might be brought on by loss of sleep, by skipping meals, by changing time zones, then we really want to help people create consistent windows for going to sleep and getting up, and to avoid multitasking. And this may be a challenge because people may be very good at it, but encouraging that when they are eating, they just need to eat. When they are working, they just need to work. And this helps their body know what they should be doing at any particular time. Now, anthroposophic medicine is not just about lifestyle recommendations. There's actually a tremendous variety of medicines which have been developed. And these come out of herbal and homeopathic traditions, although there are a large number of medicines that have just been developed specifically as anthroposophic treatments. And one of them brings together 3 different components. It includes silica, quartz, and there are preparations of silica which are very helpful for strengthening and bringing into better balance the activity of our nerve sense system. So archetypally, we could say whenever there is a nerve sense system in balance, we can look towards different kinds of silica preparations as being helpful. In contrast to that, whenever the metabolism, the digestion is out of balance, we can think about sulfur. These are not new approaches that are specific to anthroposophic medicine, but this kind of combination is unique. And for the middle, we need a kind of mediating activity. This is brought through iron. The specimen here is actually pyrite, which is a combination of iron and sulfur together. But when we bring these three elements together, usually in a tablet or a powder form, we get something called biodoron. This is a medicine which comes from Rudolf Steiner, an indication for migraine, bio meaning life, and doron, gift. So this is a very balancing, archetypally balancing medicine, and sometimes it was also recommended as a remedy for, quote, too much civilization. Now, if we go to a third example, instead of hypertension or migraine, we're going to look at irritable bowel. And if we start again with basic dynamics, this kind of centripetal constricting activity, we can think immediately of spasm in the bowel, and both spasm and spastic constipation can be part of an irritable bowel syndrome. We can really think about, in this case, the nerve sense activity, which even though it's mainly in the head, is active through the whole body, that this kind of constricting, forming activity has come too strongly into the gut. And so there's really a nerve sense dominance in what should be primarily a metabolic organ when we have spasm and spastic constipation. On the other side, with irritable bowel, you can have primarily symptoms of frequent diarrhea and urgency. And there it's not hard to see that there's an uncontrolled release and dissolution process. There is a metabolic or a movement dominance, that things move very quickly through the bowel, and this urgency speaks to a kind of uncontrolled movement. And then in the middle, we can have an alternating constipation and diarrhea, which is really a picture of irregular peristalsis, a loss of digestive rhythms, and a loss of healthy rhythmic activity in the digestive system. So for the spastic cramping constipation pattern, this is very often painful, and pain is really an accentuation of sensation. There is too much consciousness in the gut, too much contraction, and sometimes people will find that they are really triggered by anxious situations. The stronger their nerve sense activity, the stronger the cramping in their gut. On the other side, we have this diarrhea with watery stools and urgency. And we can say where with the cramping and spastic constipation, there was too much consciousness. Now there may be too little consciousness. And suddenly there's just the need to very quickly evacuate without any warning. There's a general loss of form. The stools are watery, and very often you see existing metabolic imbalances or intolerances for foods, which naturally, when the body can't digest something well, it just wants to move it quickly through the system. And then there can be, in the middle, the alternating pattern of diarrhea and constipation, where there may be a week of constipation, and then a week of very loose stools. It can be hard to know where anything is going to be at a particular time. It's hard to plan ahead, and this can be very disruptive for activities. If you look at the Rome diagnostic criteria subtypes for irritable bowel syndrome, they describe a constipation type, a diarrhea subtype, a mixed subtype, and then one which is not subtyped, just a general diagnosis. And if you compare them, you will see that there are slight differences between the Rome diagnostic criteria and these anthroposophic differentiations, mostly because the anthroposophic approach is trying not just to look at the stool pattern, but really at the whole physiologic gesture. So if you are treating someone for irritable bowel, you want to ask not just about their digestive system, but you might also look at their sensory patterns, at their sleep patterns, at their stress patterns. And those kinds of larger pictures help inform an overall diagnosis. Again, there are very unique medical preparations that have been developed out of anthroposophic practice. And for the type where you have a lot of diarrhea, a lot of watery stools and this loss of form, then there are different medications that have stibium or antimony in them. This is a mineral, a metal, and it is amazing because it always forms these incredible crystals. Lots and lots and lots of finely differentiated form. And this is very helpful for bringing healthy structure back into metabolic activity, into digestive activity. So we have stibium on one hand. On the other, particularly for the spastic constipation, there's a medication called carpellum molly compound, and it is made from elements of the apple seed and then also the walnut. Very different form. There's this kind of encasing with fruit inside, and we're trying not to bring form, but we're trying to bring vitality. So we're using elements from the seeds, and this helps to balance this kind of spasticity. And then what's quite remarkable, this is an indication for a medicine which also came from Rudolf Steiner, is something which is a gift for the digestion. And this is made from a combination of different ferns. And you can see it's not just one plant which is given, but a whole series. And we can see from these series of plants that we go from a very simple, sort of simply lobular leaf to one which is differentiated, to one which each one of the fern strands is differentiated, to one where each of the strands has its own differentiation. We're going from a very large round form to a very highly differentiated form. And what's amazing about this medicine is that it helps to bring a middle point so that when digestive activity has fallen out of balance one way or the other, this preparation helps bring more digestive balance, more rhythmic balance, and can be particularly helpful for this pattern of alternating diarrhea and constipation. So 3 different diagnostic pictures for irritable bowel and 3 different medications specifically crafted to support the underlying imbalance. Now, this threefold view of the human being, this understanding of dynamic physiology, has also been developed and really refined through many other kinds of therapies, where you can take this differentiation of a nerve sense system, a metabolic limb system, and a rhythmic system, and see how it fits into artistic therapies, massage, music, and movement. So this threefold approach really stands at the heart, not just of anthroposophic medical preparations and diagnostic approaches, but also movement therapies, artistic therapies, massage, counseling, and nursing approaches. And this really creates a beautiful, broad toolbox. And so in anthroposophic centers, there's very much the goal, not just that someone is being treated medically, but that they are also being given opportunities to help balance their own physiology, to participate in their own healing process. To learn more, you're invited to visit the website of the International Federation of Anthroposophic Medical Associations. This is ivaa.info. In addition to that, there is anthromedics.org. This is a website which really offers a lot of different articles explaining basic concepts, as well as some examples of specific practice recommendations for clinical areas like oncology, palliative care, pregnancy and childbirth, treatment of acute illnesses and fever, as well as sleep, anxiety, and post-traumatic stress disorder. For North America specifically, at anthroposophicmedicine.org, you can find the Physicians Association. This has information about training programs. These are open to anyone who has a medical license to prescribe medicines. Anthroposophicnursing.org. This is the Nurses Association. Find information about training for nurses, as well as different home care courses. And anthroposophichealth.org. This is the umbrella association for all of the different anthroposophic therapies and includes a provider directory. Thank you for participating in this introductory series. We hope that you've learned something about anthroposophic medicine and this very holistic, optimistic, and diverse approach to bringing health to the whole human being. Thank you.